Well, it's 12:01 and good afternoon, everybody, and welcome to Psychiatry Grand Rounds, the first of our Grand Rounds for this season. Just a couple of announcements. When you've signed in to attend Grand Rounds, you are signing in, but in order to receive credit for attending today, you need to fill out the evaluation on the Survey Monkey that is listed at the top of the email you got about today's Grand Rounds. Grand Rounds is going to be on Zoom for at least the rest of this calendar year. What happens in 2022, we have not made a decision yet whether it will be Zoom or in person. I mean, there will always be this. If you have questions for today's speaker, please type them in the chat and we will ask the speaker the questions at the end. Next week's Grand Rounds is a joint Grand Rounds between the Department of Psychiatry and the VA. The speaker is Dr. Brianne DeBeer from the Rocky Mountain MIREC for VA Suicide Prevention. This is in keeping with this month being Suicide Prevention Month. And the title of Dr. DeBeer's talk is Suicide Prevention, Building an Evidence Base for Strategies that Promote Connectedness. So it's my pleasure today to introduce our chair of our department, Dr. Kimberly Yonkers. Dr. Yonkers is a graduate of Amherst College and received her MD from the Columbia College of Physicians and Surgeons. She completed her residency training in psychiatry at McLean Hospital, followed by a fellowship in neuroscience at Harvard Medical School. Immediately prior to joining our department as our chair, she was professor of psychiatry at the Yale School of Medicine and held appointments in the Department of OBGYN and Reproductive Medicine and in the School of Epidemiology and Public Health. Dr. Yonkers was recently invested in the Katz Family Chair of Psychiatry at UMass Medical School. She's a physician scientist. She has conducted numerous studies supported by the NIH. And the focus of these projects has been exploring optimal ways to identify, engage, and treat mood disorders and substance abuse disorders in women. Her impact on the field of mood disorders in women is substantial. Some of her contributions include confirming the criteria for the severe form of premenstrual syndrome known as premenstrual dysphoric disorder, establishing treatments for premenstrual dysphoric disorder, tracking the course of perinatal depression, and identifying behavioral health risks to healthy pregnancy outcomes. Leadership is a critical component of Dr. Yonkers' biography. She chaired permanent and special grant study sections for the NIH, was a member of the task force for the DSM-5, and sits on the steering committee for revisions to DSM-5. She has served as president of the North American Society for Psychosocial Obstetrics and Gynecology, chaired the Women's Committee for the American College of Neuropsychopharmacology, participated in planning committees for biological psychiatry, the American Society of Clinical Psychopharmacology, and the International Association of Women's Mental Health. She is also editor-in-chief of the American Psychiatric Association's newest journal, Psychiatric Research and Clinical Practice. Dr. Yonkers is an active educator and mentor. She is author of more than 130 peer-reviewed publications, 26 chapters, and 2 edited books. Among her invited lectures and awards are those from the American Psychiatric Association, College of Obstetricians and Gynecologists, and the Academy of Consultation Liaison Psychiatry. However, she will not be speaking on those areas of expertise today. We will bring her back to do that, but the title of her Grand Rounds talks today is something closer to home: UMass Psychiatry, Accomplishments, Challenges, and Opportunities. Kim.
Thank you so much. It's a pleasure to be here. Let me see if I can advance. Why is this not working? Okay, there, okay. It's a pleasure to be here, and I'm happy to come back and talk about one of these research endeavors at any time that people want to, or just stop me in the hallway and I will wax on as needed. Anyway, these are my disclosures. They include royalties from UpToDate, as well as research funding from PCORI, NIAAA, NICHD, and NIMH. So I think that many people on this Zoom Grand Rounds have met me before, and we've had a chance to talk to me about my life a little bit, but not everybody probably has heard about me. You heard really some very nice words. Thank you very much, Dr. Rothschild. So I just wanted to mention, I haven't been here a full year yet. I started here in November of 2021. You heard that I went to medical school at Columbia, which also has a new name. It's the Vagelos School of Medicine. I did my residency at McLean. I was at Yale for 21 years. And my research, as you heard, focused on women's mental health. And clinically, I worked as a CL psychiatrist for several decades, and I ran our CL psychiatry service at Yale New Haven Hospital, which was really just a tremendous experience. I enjoyed it a great deal. So you may recall that when I came, I did something. I took a page out of Hillary Clinton's book, and I did a bit of a listening tour. And you can see this is a huge department. It's rather daunting to get to know people and services and what we have to offer. So I wanted to share with folks at this Grand Rounds some of what I learned. Many of you already know it, so I'm probably repeating things that you already know, but it's such a huge department that you may not know some of the rich resources that we have. So this is just indicative of what we have as a department, a really, really tremendous department with multiple sites. So of course we have our units here at the university, and we have our new partner in Harrington. We also have Marlborough and Clinton hospitals. So the system is rather large. The Worcester Recovery Center, just one of the jewels in the crown, not just of UMass, but also of psychiatry writ large in the state of Massachusetts. We have VA partners with a lot of strong research at the VA, as well as solid clinical care. We have DMH sites outside of Worcester Recovery, including Taunton, Pecasset, and Brockton. And another really unique part of our department is the relationship with Community Health Link. Our faculty staff many components of CHL, and that is a really large mental health program for the state of Massachusetts, well, for central Massachusetts. Our outpatient clinic is a really pivotal component of the department. I was just on a meeting for the neuroscience line, and singing the praises of our OPD. Many academic programs in the country no longer have outpatient programs or outpatient clinic like we have. We actually have a relatively robust one, although it can't do all that it needs to do. But we really need to appreciate that we have that. And then Can Do, which is our clinic for kids with developmental disabilities and autism, a specialty clinic that many places in the country would just love to have. We also have a number of divisions, a large number of divisions. My apologies if I missed anything. We have forensics, we have neuropsychiatry, we have addictions, we have emergency mental health, we have CL, geriatrics, neuromodulation, child psych, Shriver and the Candy program, iSpark, which is in part supported by the state of Massachusetts, but in large parts also supported by grants. Lifeline for Families, which is a very unique program led by Nancy Byatt. Our Forensic Center of Excellence, our Addiction Center of Excellence, our Center for Psychopharmacology Research and Treatment, and the Mind Clinic and Research. So hopefully I've hit upon something that people didn't know about before. Just reiterating the breadth of the department. We've had a lot of accomplishments. I know in past years you've heard about accomplishments from Dr. Benjamin and as well as his predecessors. So I'm going to focus on what's been going on the last year. Not that I really need to I don't want to take any credit for this, but it's just nice to see what's happened over the last year. So we've had ladder promotions. You can see on this particular slide that we have in blue, we have promotions and we have appointments. We're hoping to pick up the yellow box a little bit more and have some tenure. I think it shouldn't be totally gone because there were 2 people who were given tenure this year, but we need to pick that up. But we're very proud of all the promotions during this past year. And I hope for people who are listening to this presentation that you will start to think about promotions, because that's really a very important, I think, opportunity for academic faculty. You know, you don't get promoted in private practice, but one of the wonderful things about being here is you can actually work to promotion and feel good about your accomplishments as you do that. These are people who were appointed as assistant professors this year, so it's a large department. We have a lot of people who were promoted, and you probably have heard during various faculty meetings about some of these people who have been promoted from instructor to assistant or hired as assistant. I'm not going to go through all of these names, but let me just congratulate this entire crew. We have fewer people who have been promoted to associate professor, and we hope that list will continue to grow. And then we've actually had quite a few people who have been promoted or appointed to full professor, and that's what's on this list. So Dr. Khurshid, myself, Dr. An, Dr. Bayat, and Dr. Fan. So we're hoping that number grows as well. In addition to ladder promotions, we have a change in some leadership that I just wanted to make sure people were aware of. So Natalie Anumba, who we heard from at the last faculty meeting, is now co-director of the Law and Psychiatry program. Gina Vincent is co-director along with Natalie. Andrea Dismore is just appointed as the director of the Forensic Service. Ashley Murray, director of Forensic Psychology Residency Program. Erica Clark will now be our director of Neuropsychology and the Residency Program. And Jeff Burrell is co-director of the Doctoral Internship in Clinical Psychology. So congratulations to folks on their new leadership positions. We also have Mary An, who is now our Vice Provost for Faculty Affairs. I miss her being part of our leadership group, but I like to think that, you know, we have a little bit of an in the office for faculty affairs to have Mary there. Lala Padilla is our residency training director and the director of diversity and inclusion. Caridad Ponce Martinez is our new addiction fellowship director. Brian Skian is our new child fellowship director. Kara Lowen Lindquist, who I don't know if she's on this, she's new to us, is our associate director for our psychiatric clerkship. Phoebe Moore is our new director of medical school counseling, and Mary Kate Miller is our new director of health psychology. So we have a lot of new leadership in the department in a very short period of time. We've also had some real accomplishments for recruitment. I don't know if he's on the call, but we're on the Zoom, but Dr. Brian Daly joined us as the new CMO for CHL, and we have already made him very, very busy. We have Dr. Bowman, who is a new attending in our PTRC unit. He hasn't arrived yet, but we have Dr. Suleiman El Amin joining us as the director at Marlborough. And I don't think she's quite come yet either, but Catherine Verdier will be joining us as an NP in our outpatient department. And we have Andrew Bennett, who just started, I believe, this week as our new attending on Century Drive, and Chris Catalfamo, who is also at Century Drive and is one of our psychology attendings. We have new folks at the Worcester Recovery Center and Hospital. Our own Colin Whitworth stayed with us at Worcester Recovery. Robert Kleiman rejoined us at Worcester Recovery. I mentioned that Kara Lindquist joined us as the Associate Clerkship Director. Carrie Wilkins is a child psychiatrist in our DMH branch, as is Cynthia Berkowitz. Why is this not going forward? And we have a number of DMH sites, and we have new people there. Dr. Rodzari at Corrigan, Dr. Epox at Taunton, Dr. Turk at Cape Cod Islands and Mental Health, and Dr. Zuin will be joining us. I don't think she's there yet, at Cape Cod Islands Mental Health. So we continue to grow and change, and people move up the ladder. Sometimes people leave us. And we have a little bit of a loss in our CDRO office. I already alluded to Dr. An, and that's kind of sad because she's such a pivotal person in our department, but she's moved on to newer and bigger things, and hopefully will take a lot of the lessons or the skills that she honed in our department to the medical school writ large, as well as the other schools. And we are fortunate that Phoebe Moore, in addition to being the director of student mental health, is also going to be helping us in the CDRO office. We're pleased about that. We have had some changes to our DPAC, which is the Departmental Personal Action Committee. We've changed the membership, and Dr. An was good enough to give us a little bit of an introduction yesterday. So now the people who are eligible for membership will be full professors. That's yet another incentive for all of you to buff up your CVs and become promoted, because what's more fun than sitting on the DPAC committee? We have a chair that will be elected for up to 2 terms. And then what we will be doing for people who are going up for promotion is we'll be setting up some three-person teams to provide some feedback to candidates, help the chair out, but also help people be more proactive in getting people promoted. So I mentioned that I had this listening tour of sorts, and I learned a lot about the department. And I didn't want it to stop with me. So I wanted to share some of this with all of you. I apologize that I won't get to every sector of the department, because as I just outlined, it's really, really huge. But we just have so many strengths that I think we just need to shout it out as much as possible, so people hear about how terrific UMass is. So let me start with the psychiatric care, the clinical care that we provide. People probably know about PTRC. It's really a critical, very, very important unit, really delivers excellent clinical care. You may not know that we take care of some of the most acutely ill people in Central Massachusetts. And if you look at these numbers, I think that really drives it home. So in the past 3 years, over 70% of the people who were admitted to PTRC had a serious psychotic illness. These statistics are substantially different than virtually any other inpatient setting in the Central Massachusetts area, with the possible exception of PTRC, the Worcester Recovery Center and Hospital. So we have a lot to be proud of taking care of the really, really sick and needy patients. And of course, we really focus on our catchment area. So nearly 80% of them come from Central Massachusetts. So those are some of the strengths for the PTRC. PTRC has had some struggles in the past, and they haven't all gone away. Probably the greatest one is that it's off-site, so that always increases some degree of risk for it. Staffing has been a real challenge historically, but nothing could parallel what we're seeing during this pandemic. And that is, I talked to some of the other chairs in Massachusetts, they're seeing it. Chairs across the country are seeing it. There are not enough psychiatrists, there are not enough behavioral health APRNs, there are not enough behavioral health nurses. So all along the line, psychologists, social workers. So it is always a threat. And as a standalone unit, something like PTRC is very expensive to run. So those are threats, but it is some of the opportunities. It's a wonderful training site. I hear very, very positive recommendations from PTRC in terms of training and teaching. And it could be a stronger research site. So more to look forward to in that domain. Aid East is another sort of unit that we have at the university, if you will, considering PTRC is sort of quasi-university. And it really delivers excellent medical and psychiatric care. It was just reviewed by the Joint Commission and had nearly a perfect score. So this is really hot off the press. It really has first-rate programming and can accommodate not every medically ill patient with a behavioral health need, but certainly a lot of them. And I can tell you that other physicians at the medical center, the leadership at the medical center really appreciates how Aid East has just stepped up to the plate. We have been filled to the gills in terms of patients at the medical center and in the system. You know, COVID and the post-COVID push have really been very, very all-encompassing. You know, St. Vincent's strike has hurt us in terms of the number of beds, but Aid East has really delivered in terms of taking people from throughout the system. It has an excellent reputation in the community. The psychological and occupational therapies are top-notch, and it's also a stellar educational site. And if we could only clone both PTRC and Aid East, it would be fantastic. It also has some struggles, though. It's a small unit. It only has 14 beds, and they're all double beds, double rooms. So if we have to take a room offline because somebody has an infection or because we need to set aside a room for people who could become COVID positive, we lose 2 beds. And given the pressure to have more beds at our medical center, that is very, very tough. It's a wonderful training site. It would be great to find ways to increase the training opportunities there. I know that there was in the past a partial hospital component. It would be great to have some of that in the future. So we're going to look toward opportunities. Emergency mental health services is critical, and we are a very high flow center for emergency mental health needs. And our emergency mental health services really fill a lot of the psychiatric beds in central Massachusetts. So they touch us to a great degree. And then, you know, we send them out to various hospitals. So we do a ton of work. And thanks to all of the people who have been working as providers in emergency mental health services, it hasn't been easy. Sometimes I'll get on a morning call and hear that there are 30, 35 patients in our emergency mental health services, and we are terribly constrained because technically we can't really keep people for days and days. I mean, we really are supposed to be able to evaluate them and send them off. And that just hasn't been possible in recent months with the pandemic and with our really crushing need to take care of kids who have behavioral health needs. And that has been a struggle. You've probably read about it in the Boston Globe. You've probably heard about it. And nationally, even NPR has had pieces on what's been happening with kids and their need for behavioral health services. So kudos to everybody that works 24/7 in emergency mental health services. We have a stable cadre of people who are working there, and then a lot of our faculty pitch in and do extra shifts. It's needed and it's tough work. Some of the weaknesses and threats that I've heard, again, staffing, lack of reimbursement. When you consider all of the work that we do over there, the reimbursement is really embarrassing. And that I wish that there were ways to address it. We're trying to do what we can to address it, but it's really a problem. We have stuck patients. We have some patients, thank goodness we have our own units like PTRC and Aid East, because there are patients that other hospital facilities will not take, and we are it. So we have to take care of the patients that other people will not accept. And that goes for kids. I mean, we've had kids there for weeks on end this past summer. And it's really been a crisis that we've had to contend with, and that our emergency mental health services has had to contend with. Some of the opportunities, it's a great training site. And I think a lot of people really want to do more training in emergency mental health services. It's also a potential research site. Ed Boudreau is a researcher and a psychologist in emergency services, not in our department, but he's secondary in our department. And we'd like to work with him and with others to increase research. And it's also an opportunity to test novel systems of care, because our emergency mental health services works a lot with CHL. So that's a really important partnership for us. We're also a leader in the region for neuromodulation. And there are other centers, but nothing is like us in terms of the experienced faculty that we have, who also have research experience. We have data-driven protocols that are really important and really put us on the top of the heap here. We have 2 TMS units currently. We have a 3rd on the way. We have a lot of potential research and clinical expansion opportunities throughout the system. So stay tuned. I think you'll hear more about that. One of the weaknesses is we still don't have a permanent home for outpatient ECT. We've been doing it in the post-surgical unit over in the university, and that is only a temporary solution. There are a lot of folks who need ECT, and we need to find a solution to that. I can tell you that I was just on a call with the system, and the system is in support of finding it. So it's been a long time. I think we've been working on it for 5 years, but hopefully, and I think Dr. Benjamin has some of the worry scars to go along with trying to get this off the ground, as well as Dr. Kershid. So I want to thank you for your efforts in this regard, and hopefully we can bring some closure to this. As the only academic program in Central Massachusetts, we have to have ECT. It's not an option. It is a critical component of our psychiatric armamentarium. So most of you know about Worcester Recovery Center and Hospital. I don't know if you've been there. I know many of you have. I can just tell you, the first time I saw it, my jaw dropped. It is just an amazing facility. It really speaks to the commitment toward mental health that the state of Massachusetts has, and the commitment that we as a department have to both staff it and bring the best possible programming that we can to it. It's just really amazing. I think we're supposed to have 260 beds for adults, but I think there's more than 290. And there's a lot of pressure to continue to admit patients to this facility. We have 60 beds for kids, and that will actually change. One of the units is going to be moving off, and we'll be expanding the adult beds by 30. We have one of the only deaf units in the entire country, which is kind of amazing. And not only is that, well, I'll talk about that as an opportunity, but it's an opportunity for care. It's an opportunity for research. This is a public sector initiative with an academic affiliation. It really puts us out ahead in terms of public sector psychiatry. We have amazing forensic services. Many of our units are run by forensically trained psychiatrists. So this is just, I've never seen forensic services like we can offer here. And we all should be proud of that. And it's nice the way that the attending and other staff work together at Worcester Recovery, because they provide consultations, they do peer supervision. It's just a wonderful, wonderful asset to the state of Massachusetts, as well as our department. Unfortunately, they also have some weaknesses and threats, including things like the documentation, part and parcel of the work. They have stuck patients. And there's ongoing pressure for them to continue to evaluate more and more forensic patients. They have not had a cost of living increase, and that creates some inequities, which is a challenge in our department that I'll talk about. And then staffing is, it's a huge program. So staffing is always a challenge. On the other hand, there may be ways to enhance and increase training. And it's such a wonderful training site that we want to do that if we can. And there are more opportunities for forensic research, as well as working with our deaf unit that I mentioned before. Community Health Link is a very, very critical component to our department. They have an array of services. They go from children to geriatric behavioral health. They have 24/7 emergency and substance use evaluations. They have inpatient resident recovery and outpatient services. They also have primary care for our mental health patients on site, which is very nice. Again, staffing and workload are always challenging, as are salaries, but we've had some new, we have some new opportunities. I mentioned that Dr. Daly joined us, and the CEO is new, relatively new, Tamara Lundy, and she is fantastic. So we've got a great new leadership team at CHL. We have wonderful faculty for them to work with. So we're really excited about that. And a new initiative between Dr. Fahn and CHL, which is to find innovative ways to take care of our patients with severe persistent mental illness. And we're hoping that is also going to lead to new grants, new research, and new community initiatives. So that's more to come on that. So I want to talk a little bit about the research at UMass. We have, these are just some research dollars, new awards. There's some spikes in this depending on centers getting funded, but you can see that we do have a robust research endeavor. I want to shout out to our Addiction Center of Excellence and Dr. Smelson and Dr. Gonzalez, who have just landed a $12 million HEAL grant. That project alone will require recruiting 1,000 patients with comorbid substance use or opioid use disorder and mental health issues like depression, anxiety. So you'll hear more about that, but it's just, and it's based upon the mission model that Dr. Smelson was involved in developing. So kudos to them. It's a great opportunity for the department. It really speaks to the strength of the department and the research that's going on here. So we're thrilled about that. You know, the chancellor and the dean have been talking about the Chan gift. We can talk about, you know, some of our initiatives here in research as well. iSpark is yet another jewel in the crown of our department. And we are just thrilled to be able to have them. And it's really important that we find ways to support them. This is a really dedicated, successful research group. And let me just say, as a researcher, when I look at the department and some of the departmental needs and the things that I wish we could have for the department and develop our faculty and develop our research potential, and then I talk to Marianne Davis and find out that iSpark is already doing it. So whether we're talking about grant reviews or mentoring, they really have a very wonderful system, a really fine-tuned group of researchers, and they've developed these really nice support systems for grant writing, stakeholder engagement. They focus on public health research for people with mental health conditions, especially the transitional age youth. You know, some of the struggles they have are shared by a lot of researchers, like relying on soft money, which is very, very tough. They need to maintain a strong mentoring pool as new researchers come up. They are partly supported by the state. We need to make sure that that relationship is strong. And find ways to even leverage that more if we can. I think as I go out and talk to other people in other institutions, it's just terrific that I'm able to talk about iSpark and some of the research and generate some interest for people to come and join us here at UMass. I mentioned the Center of Excellence in Addictions, and that's yet another area which I would love to see grow, but it's a really, really strong group for research. And I don't know if people appreciate the level of research that's being done there. They're innovators in translational science. This group focuses on our underserved population. They have a very solid track record of funding and a lot of support for junior faculty. They use a collaborative team-based science approach and they have an international research portfolio, so they work with people outside of our country as well. Like iSpark, they struggle. They have to rely on soft money, which is a very, very tough life. By the way, you may not know what I mean about soft money. So hard money are things like state lines or system supported funding. Soft money is when you have to write a grant every couple of years to make sure that you have enough money, and you never know whether the grant's really going to be funded. So that's very, very tough. They have very limited space and limited statistical and analytical support. So these are some areas that we really need to take a strong look at. But there are lots of opportunities. So they can bring in other people from the department via T32s and center grants. They can partner with state agencies, which they do a lot of now. So there's really an opportunity to grow the research in this division as well, especially with regard to disparities in economics and imaging research, which currently is really minimal. I would be remiss if I didn't mention the Shriver Center and the Candy Lab, which is under Jean Fraser's leadership. It's also a part of our department. That's a really talented research group. Very, very important also to our child trainees, as well as other researchers and people who have research interests in the department. A talented research group, and they address a broad range of, they address developmental disabilities, but from a very wide lens. They have a national recognition. They're nationally recognized for their research. And when I talk to people from other institutions, they mention iSpark and the faculty in iSpark. They have a solid track record of NIH funding, which is not easy. They also have a lot of interdisciplinary reach with pediatrics and PQHS. They have the same threats that our other research departments have, which is dependence on soft money and size. But there also are opportunities to grow through philanthropy and medical school support and increase collaboration with other sectors of the school and the system. Our education in our department is really, really at the top of the pyramid, and it reaches into every component of the department. And we should be very, very proud of the large number of faculty that participate in education. And it's MDs, it's PhDs, APRNs. We have very dedicated faculty. They're really talented. You probably know already that we have one of the only neuropsychiatry residency tracks in the country. I always forget, are there 4 in the country or 6, Shell? You're constantly having to remind me.
4.
4, yeah, 4 in the entire United States, which is tremendous. We have the combined child and adult track and a child fellowship. We were one of the leaders in that area. Now other places have jumped on board. We have strong partnerships with DMH in community and psychiatric settings. And we're hoping that we can expand that to the community relationship to research as well. And we have very, very strong placement sites. You've already heard me talk about them. But as with other divisions or sections of the department, there are also some threats. So given the size of our department, which is almost 400 faculty, our residency program and our fellowships are pretty small. So there are a lot of opportunities, but we haven't been able to increase the size as of yet. And then the class size decreases as some of our trainees go off to do more in child and neuropsychiatry. Some of our training slots are dependent on the state funding. So, you know, that is a threat and we have to be mindful of that. And then teaching needs are going to increase as the medical school size increases. You probably heard from the chancellor that we're anticipating gradual increases in the size of the medical school. So that's going to be challenging for us because we'll need both teachers and we'll need places where they can be taught. But there are lots of opportunities. You probably heard that Harrington is now part of the system. So with Harrington, we have additional sites and opportunities, as well as teaching at Marlborough with our new director who will be coming. We have close relationships with the state that we can leverage even more to build in more training opportunities. We have a new group that's working in social media that can promote some of our excellent training opportunities and bring trainees in. And then I think one of the biggest assets for our education program are our trainees themselves, who are our ambassadors. They are really, our programs are built on our trainees. So the more that our trainees are linked to us, talking about us and working with us, and the more we can do to support them, especially during this time with the pandemic, the better. So thank you to our trainees who are our ambassadors. So what can we look forward to as a department? And this is sort of a fancy way of saying, what are some of the departmental goals that I hope we can work on? And this is in part some of my thoughts as well as thoughts of the leadership. We clearly need to enhance the diversity of our faculty and our trainees. And that was already an initiative from the chancellor, from the dean, from the system, from our department at every level. And it's not just talk. There's really been a number of initiatives. We're thrilled that Dr. Padilla is leading this effort in the department, but she's not alone. And, you know, we're starting this from the ground up when we look at people who are applying for jobs, when we're looking at our trainees. Diversity is really front and center. We also need to educate ourselves about diversity. So we can't just think that we're going to bring in people and, oh, that's great, we're going to be diverse because we're going to have diverse people, and that our own mindsets are going to change along with that. That's too burdensome to people, and we need to address that ourselves. Some people probably on this grand round have been involved in a book club to address diversity, but there are a whole host of different ways that we can educate ourselves through research, through reading, through talking, through learning.
God.
Really?
Another initiative.
Running up
Oh,
through the lab, run back
through the wood, Courtney.
I think somebody needs to mute themselves, please. Another departmental goal with regard to recruitment and retention is we need to improve our salaries and our salary equity. We need to be more competitive in the market, and that's at every level. That's at research assistants, that's at psychologists, that's psychiatrists. So we're looking very seriously at that, and we hope that within the next few months, we'll have more to tell you about how we're going to address this serious inequity, as well as hopefully make some changes in terms of salary rates. We need to tell the world about UMass, and we're hoping that one way to do this, at least, is to revamp our social media presence, And we want to, in addition to that, encourage our faculty, find ways to encourage our faculty to give presentations, to talk about UMass, to talk about the clinical work that's being done here, and to talk about the research that's being done here. Another bucket of goals for our department is research. We really need to strengthen our research even more and to increase the research endeavor by recruiting people like new tenure track faculty and new research faculty. We need to continue to build. We have some great collaborations with pediatrics, with PQHS, with OB-GYN. We need to continue those, and we need to build upon that with other departments. One of the things that's ongoing in the background is trying to readdress their neuronexus, which is a collaboration with neurology, with radiology, and with neurosurgery, and with basic neuroscience. So we're working on, if you will, updating that and bringing some more strength to that. Internally, we need to develop additional mentoring and grant writing capacity. We're really fortunate that iSpark has a model for doing that, so we can leverage some of their talent to bring that in a wider range to other sectors of the department. I'd really like to see us strengthen our relationship with our research partners at the VA and CHL. I think it's already happening with the VA. Some of our colleagues at the VA are now working on an initiative, a huge grant with the Department of Medicine, a tech grant. So we're always looking for ways to do that. We're also, I'm also looking at some additional structural and administrative means to support some of the research endeavors, because it's really tough to live on soft money. And you know, that's a difficult nut to crack, but we hope to see more going forward. You know, people are in this department because of the academic activities as well as teaching. We want to provide good clinical care, excellent clinical care and research, but it's difficult if you can leave our department and make another $25,000, $50,000. You know, why are you here? So we need to find ways to reward our faculty for the terrific work that they do. And some of that is academic activities. Teaching, of course, remains a very high priority. A lot of people are here because of the teaching, but we need to expand our mentoring activities, our clinical expertise, our leadership, our promotions. Some of the programming that we're starting today actually is a writing group. So we need to develop more programming for writing manuscripts and giving presentations and supporting our faculty who want to be able to write more and teach more and give more presentations. It's good for our faculty, it's good for our department, it's good for our institution. There's no downside, except for the downside is it takes time. We have to find time and ways to give people some time so that they can pursue these activities. And we need to look for opportunities for our faculty to participate, and that includes in local, national, and international societies, to be leaders, not just here at UMass, but on the broader national and international canvas. We really, really value patient-centered care. I hear much about that at the system level, and it is critical for our department. We're leaders in patient-centered care. We need to continue that. We are leaders in advocating for our patients on multiple different levels. You know, our footprint in community and public psychiatry really shows how committed we are to the patients who have severe and persistent mental illness and need us to advocate for them. And we have multiple tentacles in public psychiatry and community psychiatry. We need to strengthen that and make sure that the systems that are in place to continue that work. We really provide excellent care here. People know that. We wish we could take care of even more people than we can, but we can continue to provide excellent care. We need to enhance multidisciplinary approaches as much as possible. And I know that that's ongoing in multiple sectors of our department, and we need to make sure that that's strong and that it continues and grows. And we need to collaborate with other departments in the provision of care. You know, I talked about PTRC being off-site. People at other parts of the system and the medical school, they don't know what goes on at a lot of our departments. They just know that they can't get their patients seen in our outpatient department. And so we need to educate them on what we do and why and how important it is. Because really, I tell this to my general medical and surgical colleagues all the time. Someday you're going to need us. It may not be now, or you may have needed us already, but they really need to be educated on the care that we provide. So, and that's what I have to say. And now I have an ask for all of you. And that is, what can we as a department, as the leadership, what can I do to support you? Because we want you to be healthy. We want you to be happy. We want you to be engaged, and I need your input. This is what we refer to as a pick chart, which is possible, you know, ideas that are possible to implement, that can be implemented, that need to be killed because they're just not good ideas, or they're too expensive, we can't do it, or that are challenging. So you see, here's ease of implementation. Here's the payoff. These are things that are a high payoff that can be implemented, that could be implemented with a lot of work. These are possible, and these are just low payoff and hard to implement. So tell us what you need. Tell us how we can help keep you in the department, be an active member of the department, want to go to work, want to be interacting with other people, want to seek out, you know, some collaboration with research or with other members of the department. That's how we build, that's how we stay strong. So I hope to hear from you. And with that, I think I don't know if we have any questions.
Yeah, yes, thank you very much, Kim. We do have a question. And just a reminder, if you have questions for Dr. Yonkers, please type them in the chat. Question is, I would like to hear about the current status and plans for the ketamine clinic at OPD.
Okay, good question. So we have started ketamine at the OPD. It's been challenging because staffing, but the bigger challenge has been getting reimbursement for ketamine. So it has taken us 6 months to get approval for the first patient who already received ketamine. And we still don't have money in hand. So until we have the systems in place on how we can actually get reimbursed for the treatment, Dr. Harrington and I are going to actually try and see if we can put forward some ideas and work with stakeholders to try and figure out how to get this done. But there are multiple levels of problems getting ketamine going. So it's at a bit of a pause right now, but we're hoping to explore how we can get that done. But it's a big challenge. Other questions, comments? Do people feel like they can fill out a pick chart and send it to me or send it to Debbie? Hopefully.
So the question about as ketamine now would fall in your pick chart under challenge, if I understand correctly.
Yes.
High
I
pay-
would put it, yeah, I would put it in challenge. Yes, definitely.
I mean, it's a little bit like the ECT. It's something an academic center ought to have.
It is definitely like ECT. It may even be harder in some ways to get than ECT though.
Right.
And the reason it's harder is because a lot of it's out of our hands. ECT is internal. It's us to find a place. But getting insurance companies who have already authorized ketamine treatment to actually pay, so they authorize it and then they say, well, we don't really have that as a code. So,
Okay, I'm getting more questions. A question, first of all, if Kim, if you could have Debbie send a template out of the
Yep.
chart.
That'd be great.
Next question is, how do you feel about the institution's commitment to the department?
The institution meaning the school or the system. So I actually think the commitment is very, very strong. It's really strong in the medical school side. And I have to say that I think that the system commitment is also very, very strong. I already alluded to the fact that many academic institutions, probably most academic institutions, don't have a robust outpatient department like we do. That is a big commitment on the part of the system to keep that up and running, because it could be a very attenuated, tiny, tiny clinic. And it's not huge, but it's not tiny, tiny. The system also subsidizes the CHL, which is a very important part of our mission and our department. So, it's always challenging. We are not making the system a lot of money. In fact, we're costing the system a lot of money. But I actually feel very, very positive about the commitment from the system to the department. And I have heard nothing about cutting beds or cutting services, even in these very, very challenging financial times. COVID has hit us and it's hit medical systems across the country very, very hard, not just in terms of fatigue and burnout, but financially. And our system was looking at a $50 million deficit just a few months ago. And I heard nothing about trimming our services at all. So I feel very positive about the support that we're receiving from the system and what's going forward.
Okay, another question. How do you advise finding out about active ongoing research among faculty in the department? Is there currently a central database to promote collaboration and cross-faculty engagement?
You know what? I don't think there is. And that is a wonderful idea. I would put that in the blue box on this pick chart, which is easy and possible. And we certainly, I have to check with Janice in the CDRO office, but we could put that together. And
I think it's a great idea too. The other enhancement that you're working on is websites, which will help with this.
Yes, absolutely. The websites, I'm so glad you pointed that out. Websites will help with that. And that's an initiative. A social media and a communication strategy is something that we're working on. And everything will have the new UMass Chan on it as well.
Well, listen, that's all the questions we have, but thank you very much, Kim, for kicking off our Grand Round season in a wonderful fashion.
Thank you. And I want to thank everybody in the department for coming and for all of the work that you do. And just know that you're very, very valued. So my gratitude to you, and people stay well.